So I'm just checking. You're going to hear a few noises as other people are coming into the room. So just ignore that one and enjoy. So my name is Angela Raspis and I take care of marketing and communications for DFKANZ. And I'd like to welcome you and thank you for deciding to invest your time today in this incredibly important subject. It's always an important one, having good mental health, but of course with what we're all experiencing, which is, I'm sure you've heard the word unprecedented, used once or twice in the last few months, but with the unprecedented conditions that we're experiencing as individuals, but also being aware of how we need to maintain the mental health of those around us or make a contribution to that as much as possible, it's an incredibly important subject for us to be looking at today. So if you've not heard of DFKANZ before, I'll give you a little bit of a rundown on who we are, but first and foremost, who will be presenting these very important ideas for you today. We have Donna Thistlethwaite, who is a speaker, a trainer, and a mental wellness advocate. And Donna has a very personal story and background which really gives her an extra level of appreciation for the importance of maintaining your own mental wellness. So thank you, Donna, for your time here with us today. But if you can just pop to the next slide for me. So as I mentioned, if you've not come across DFK Australia, New Zealand before, we are experts in compliance, accounting and business advisory, but as you can tell by the title of today's masterclass, we like to go more broadly in the way in which we support our clients and our own employees. We have local knowledge, national connections right across Australia, but we're part of a much larger family right across the world, 214 member firms in 92 countries across the world. So yes, there's a lot of the classic business work that we do, but then there is also things like during this pandemic, we've covered mental wellness, we've covered looking at your HR requirements.
Yeah, that sounds good. And
changing the structure of your organizations. We've looked at homeschooling. There's been many, many other topics that you can find on our website under the resources tab. But enough to do from me today. We're going to swap on to the next slide and look at what it is that we're going to be covering today. There is, of course, a wee disclaimer saying that if you do find yourself in a situation where you're needing more acute help beyond the summary and the ideas that we share for you today, then we please encourage you to do that. What we're presenting today is a summary only. It's not comprehensive, but it certainly gets you started in the right direction. And on the next slide, we have all the topics we're covering. So we'll be looking at how you can identify signs of a mental health problem, how to have a mental health conversation, because sometimes they can feel quite uncomfortable. So we're going to give you some great ideas how to make that go a little bit more smoothly. Looking at how to support others and yourself in a physically distanced world, and how to protect yourself against developing a mental health problem. Now, we will be recording this episode, this masterclass, so you'll receive a copy of that for you to refer back to, and a very comprehensive handout will also be emailed to you tomorrow. And the last thing for me is down the bottom of the screen, you'll notice a chat box. Now, Donna will be asking a couple of questions during the presentation, and if you can pop your answers into that chat box, I'll be keeping a close eye on those, and we'll also give you ample opportunity at the end of the presentation for any questions that you would like to raise in this very supportive environment. So once again, thank you for spending your time here with us. I'll now hand the reins to Donna and sit back and learn right alongside you. Thanks so much, Donna.
Beautiful. Thank you very much, Angela. Alrighty. So, as Angela alluded to, I was going to try not to use that you word that we hear so much, but we know that life has changed dramatically. There's no denying it. We are more restricted in many cases than we've ever been before. We're unable to connect with our family, friends and colleagues in the same way that we've always enjoyed in the past. Often we're not able to do the activities in our life that have been our coping mechanisms and certainly brought us lots of joy in our life. So we know that many, many people are struggling in our world and in our country. And so we have experienced, or support services such as Lifeline and Beyond Blue have reported additional demand around 30% on their services. So yeah, it's affecting many of our mental health. I think it's really useful to think about mental health and the fact that we all actually have mental health. And I think that this continuum is really helpful in understanding our mental health, our well-being. So ideally what we want to be doing is be at that green end where we're positive and we're functioning in a really healthy way. And what can happen though is if we're going through some challenges, or we're starting to feel unwell mentally, we can move into that amber zone, and at the other end we see where things actually can be very difficult for us and really severely impact our functioning, and that's in that red zone. So where we sit on this line can vary significantly based on things like social factors, biological factors, our access to services. It can all affect these, and it can vary even day to day. And so, yeah, helpful to be aware of. Now, I wanted to talk about a couple of common mental illnesses, and the reason I'm doing this is I want to point out it's not our role to ever be diagnosing people. There are professionals that do that, but I think in terms of understanding what's going on for ourselves and understanding the topic more broadly, it's helpful to know a little bit about symptoms that relate to different mental illnesses or mental health problems. So I was wondering if you could put in the chat box what the symptoms are that you know of for anxiety. What's it like to be anxious? I actually can't see the chat box, so hopefully Angela's going to give me some feedback from you guys.
Absolutely. The first thought that's in there is from me, and it's about racing thoughts.
Yeah, totally.
Another one that we're seeing is feeling stressed or feeling panicky, being aware of tension in your body.
Yeah, beautiful. Yeah.
Feeling helpless is another one. Feeling as though things are out of your control is another. And a sense of loss, difficulty breathing, feeling nervous or sweaty, poor sleep.
Yes, absolutely.
And your functioning is beginning to decrease.
Totally. Great. So look, I'm just going to pop up some symptoms. You've done great. A lot of these have already come up. And look, I want to point out that anxiety, feeling anxious, it's normal. We can feel it when we start a new job, when we learn a new skill, when we do something we haven't done before. But the difference between feeling anxious and an anxiety disorder is things like the duration of the experience. So usually if it's just a period of anxiety, when the stressor is removed, we stop feeling that way. It could be also the intensity. How much is this, how intense is the feelings around this experience? And also the duration. How long is it actually going on for? And the impact. How is it affecting our relationships and our ability to just get through our lives? The next one is depression. What are your thoughts around what you understand depression to look like, or what the symptoms are?
Okay, I'm watching to see what's coming in, and we're getting extreme sadness and despair, a sense of despair.
Totally.
A loss of energy, withdrawal.
Yeah.
A loss of your sense of self.
Totally.
And feeling disconnected, lots of negative thoughts, especially inwards, turning those inwards towards yourself. And the behavior you're seeing is drawing back, becoming a loner, spending less time with other people.
Yeah, absolutely. Withdrawing is a key one. So let me pop up these symptoms. And this is not exhaustive, but these are some of the key symptoms that people experience. I'm just wondering too, if these are the symptoms, how do you think they might present in the workplace? What might you see in your staff or in your colleagues? How might it impact them at work?
I'm seeing what else is coming up here. There's a reconnection to that idea of lack of interaction, not being engaged. So it's drawing back from other people. The quality of their work could be decreasing.
Absolutely.
Perhaps you're seeing forgetfulness, or there's near misses, just almost not getting something right, a lack
Yeah.
of commitment.
Yes.
Those are the type of things that are coming through, which all make perfect sense to me.
Yeah, absolutely. So these are some of the behaviors that we'd see. You know, people may be coming in late when they haven't previously. They might be working excessively. As you pointed out, the work quality may have gone down. They might be missing deadlines. And, you know, all of these types of behaviors can be indicators that the person is struggling in some way, and can then be a sign that it might be timely to have a conversation with them, a mental health conversation or an "are you okay" conversation. I haven't addressed here alcohol use or substance use. And the reason for that is that I think the signs can often be really obvious here, and I've only got a certain amount of time, but also that it often coexists with other mental health problems that we've just looked at. Now, I feel really, really passionate about equipping people to be able to have these conversations with people. So in 2012, I had a very significant mental health crisis that led to me making a serious attempt on my own life. And my life is now better than it has ever been. And I feel so privileged to be here and to actually be able to spread this message to help other people. So when it comes to having a mental health conversation with somebody, I'm going to walk you through the steps. So the first one is to ask how they are. So when you've seen some of those signs, gearing yourself up to have a conversation with them. So it might be as simple as that "are you okay" message. Are you okay? It can be great to say to them, "Oh, look, you know, I've noticed that you're not your cheerful self lately. You know, what's going on for you?" It could be something like, "Hey, I've noticed that, you know, you seem to be coming into work lately and it's out of character. I want to, you know, I really care and I'd love to, you know, sit down and have a chat with you if you've got time for that right now." So the next step is listening non-judgmentally. Okay, what you want to do is create a space for this person to be able to speak freely. You don't want to interrupt them at all, and you want to just be able to give them that time and your attention. So giving them, allowing some silence can be a really good thing, and just making sure that you don't criticize them or judge what it is that they're saying, because just that pure act of giving somebody your attention and some space, that can actually really shift things for somebody just in itself. The next one is to encourage accessing support. Okay, so as I pointed out at the beginning, you're not an expert, I'm not an expert, we're not expected to be. But what we want to do is encourage somebody to get help. Okay, so I'll run through some possible options a little bit further on, but the important thing is that they get some support. You might also ask them questions like, "Oh, have you felt like this before? What has worked for you before? You know, what support do you have in your life?" Because they might have some family and friends that they could seek support from, but they haven't actually told anyone about how they're feeling yet. So a GP can be one of the most, the best starting points for lots of reasons, including that they can refer somebody, but also that they can monitor and rule out physical issues as well. The next step is to follow up. Okay, now this really just involves checking in with someone and seeing how they're going now. Has anything changed? Were they able to get some support? How are they feeling now? And you know, it can be useful to put a note in your diary to do that in a couple of days or maybe a week, and just see where they're at now. And then, you know, if they're still struggling, you might go back to the earlier steps in this process. Just bringing up all of those steps together, so the ask, listen, encourage, and then the follow-up step. Now, there's some amazing resources out there publicly available. One I would refer you to is the Are You OK website. So that's areyouok.org.au. They have a beautiful guide there for having a conversation that you can come back to at any time in your life. And they have a very similar sort of model to this as well, that I'd encourage you to check out. So when it comes to having the conversation, there are a few things that you should think about, and preparation is key, just like anything else in life, really. I encourage you to think about where you have the conversation. You want to make sure that it's private, and I'm going to touch in a little while on having that conversation in this sort of, more virtual world that we're in. But do think about where you have it, making sure that it's private, that somebody can speak freely, that they're comfortable in the space that you're suggesting. The next one is when. So I encourage you to think about where you're at. Is it the right time for you to be having one of these conversations? Are you feeling mentally well yourself? And the next thing is just making sure that you have time to actually have the whole conversation. So there's no point in sort of just flippantly asking them, but they're not being able to sit down and actually support them through that conversation. The other thing is what is it that you're seeing in this person that's caused you to initiate a conversation? So letting them know what it is that you've observed. So, I've noticed X, earlier on I said, you're not your cheerful self, or you're coming in late and it's out of character. So let them know what it is that you're seeing, because that can help them to understand, what's going on, and for them to see that you're actually observing it and that you care about them. The other point I'd make is the importance or the value of using I statements. So that's that I've noticed this, I've seen that. And the beauty of this is that it means that, or the other alternative is that you're using you statements. You're coming in late. You're not your normal self. And the risk with that is that people can feel a bit sort of judged, um, or maybe even attacked, and they might get a bit defensive. So it's really great if you can just sort of own what you're seeing and use those I statements, and they go over much more effectively than the alternative. Okay, sometimes we face denial, okay, and that can be really challenging because, of course, you want to help, but people need to be ready for that as well. And so there can be a whole host of reasons why people will be in denial, but we can't force them to do anything. It's up to them. So what I'd suggest is that you just let them know that you care, that you continue to offer them support, just checking in with them and letting them know that you're there when they're ready, or if and when they're ready to talk. Another great thing can be to just ask them if there's somebody else they'd rather have that conversation with, where they feel more comfortable talking to someone else. The important thing is that you don't judge them, because you want to preserve the relationship with them. If that gets damaged, then they probably aren't going to come back to you, and you're never going to be able to provide that support that they might at some stage be ready for. Now, I feel like it's really important to touch on suicide, okay, because we know that 8 Australians die by suicide every single day in Australia, and that was pre-COVID. And so I really encourage you to get comfortable with asking people if they're having any thoughts of suicide or about ending their life. Now, this can feel a bit confronting if you've never done it before, but the more we ask it, the easier it becomes, okay? And so the important thing is to ask clearly and directly. Are you thinking about killing yourself? Are you having any thoughts of ending your life? The research tells us that this saves lives. What we want to make sure we avoid is putting any judgment in there. Things like, oh, you're not thinking of doing anything silly, are you? Because, clearly that's letting them know or suggesting to them you don't approve. And that is actually a bit detrimental to the conversation. So if they say yes, they are having thoughts of suicide, what we want to do is make sure that they're kept safe, okay? So don't leave them on their own. There are going to be times when that's going to be really difficult. Obviously, you can't stay with people for days, but what we want to make sure is that then they get into the safe arms of somebody else. So ideally, a doctor, a GP, maybe the mental health unit in the city that you live in or the state you're in, and maybe even a family or friend. So asking them who they would like to bring into this situation to make sure that they stay safe. And so connecting them with support similar to what I've just said is the next step. So, you know, I do need to point out that you can't have yourself at any risk either. So, you know, you need to make sure that the environment that you're in is safe. And you can ask questions like, do you have a plan? You know, have things progressed to that stage? So if they have, then it becomes way more serious and needs to be treated accordingly. Sometimes people don't want you to tell anybody about this, and that's a real risk. We don't want to keep suicide a secret. And so talking to them about who else you might be able to involve in the discussions is really helpful. So never ever keep it a secret. And if you really believe that the risk is imminent, acute, it's important that the person is kept safe, because what we know is that suicide is a permanent problem to a permanent solution to what is often a temporary problem. So we need to keep them safe, and like letting them know that, you know, things can be different, and that there is hope, that getting through this situation, you know, can very well mean that life on the other side of it can actually be amazing. You know, the way things are right now isn't necessarily the way that they're always going to feel. So here's a few of those treatment options that I mentioned. As I said, the GP can be an amazing starting point for you. Now, when it comes to the physically distanced world that we're in, you know, what are some of your thoughts around how we can support somebody, or what issues might exist in this environment? If you want to pop some answers in the chat box. I can't see them, but Angela will convey them.
I'm having a look. I'm seeing what's popping up. So one of the biggest challenges is the isolation. You're not physically seeing the person, so it's difficult to watch body language and things like that. And, there's no physically obvious signs that you could normally see when they're not physically around you. So you're not going to notice those. Those are the key main ones that have come through. Someone else is typing. People are good at masking. That's a biggie. They're good at masking, and actually that's probably one, people putting on a brave face. One that came up for me was exactly that. So you could go to have that conversation with someone and they're like, no, I'm fine. I'm fine. So that's especially in the physically distanced world would be one of a core challenge, which people are saying here.
Yeah, absolutely. Like, you're spot on. The great thing is that we have things like Zoom that give us that visual as well. Okay, so watch out for signs like they're not turning their camera on, or you know, they seem confused at the moment, or, you know, maybe the background is uncharacteristically messy. So sometimes we just have to be we have to have our radars on, you know, tuned in more to this sort of stuff, and tuned into the non-verbal cues, so the tone of voice, you know, listening out for those sort of things. So what really encourage you to do is have regular check-ins with your colleagues, your staff, you know, your family and friends, so that you're actually staying in contact, because we know that people actually need it more than ever right now. And so also it allows us, the connection's so important, but it also allows us to keep an eye on them. So you can have a mental health conversation with somebody over video conferencing, and you can also do it over the telephone. And sometimes people can feel more comfortable on the telephone because it's not quite as sort of uncomfortable or confronting for them. So it is important to think about Privacy again, so is there anybody else around? Maybe arranging a time with them when they're going to be on their own or there's no one else in earshot. Thinking about like suggesting to them, if the conversation becomes a bit distressing, like it's okay to pull the conversation up, but seeking their permission to check back in with them as well. So they can be useful strategies. Now, there are a bunch of things that can really impact our mental health. And as I said, they'll influence how we sit on that continuum we looked at earlier. So when it comes to things to avoid, the red light, so avoiding other people withdrawing, that can be really problematic for us. I'm going to have to go through these fairly quickly because the time is getting along, but you will get this information on a handout. So pushing down our feelings, no good. Don't do that, okay? What we want to do is acknowledge them, process them, move on from them. Just pretending it's not all happening, putting our head in the sand, never a good thing. Keeping it all to yourself. So, sometimes we can have a tendency, even like, I've got a lot of friends, a lot of connections, but, sometimes when I'm struggling, I don't reach out to people, and this can be really detrimental to our mental health. It can put us at great risk. Ignoring the signs of struggling, so just pretending that this isn't happening to us. So these can be all very big risks for us. Some of the, I guess, amber behaviours, if you find yourself skipping your lunch breaks a bit, working excessively, if you've got really high social media use, that can lead to a whole bunch of challenges for us. Media overload. So, gosh, during this COVID time, there's been so much media. I mean, you can turn the TV on at any stage or the radio and it just keeps coming for you. What I'd recommend is having, maybe 2 check-ins a day from a reliable source when it comes to knowing what's going on out there. Next one is working in your PJs. This is a bit tongue-in-cheek, but I actually find when I get dressed in some comfortable clothes, it lifts, or some even work clothes, it lifts my mood and helps me to be more productive. Finally, we've got some of the strategies that can make a big difference to improving your mental health. So getting some regular exercise. So I know if you're in Melbourne, this might be really difficult at the moment, but I've heard of this woman. I haven't actually done this yet, but I think it's Yoga with Adrienne. Like, this woman's in America. She's got a massive following. There are things that we can do in the comfort of our own home just to get the endorphins happening and to actually, just be moving our body. So making sure that you get good sleep, have a healthy diet, connection, so connecting with people, so reaching out, whether it's by telephone or virtually, making sure, like, just because we're physically distanced doesn't mean we have to be social distance. Never has it been more important that we're connected with people. Being kind to yourself and to other people. Kindness can it can cure so much. And if you find yourself saying things you wouldn't say to your nana or your daughter, then it shouldn't be said to you either. So be very kind to yourself. Relaxation, making sure that you take time out and get away from technology and all of the other things that drain our energy and our attention. Finally, gratitude. How am I going for time, Angela? Have I got time to talk about gratitude a bit here?
There's always time to talk about gratitude.
Beautiful. Yeah, Angela and I are both converts to this. So the research has shown us that gratitude absolutely positively impacts our lives. So when we tune into gratitude, that radar just keeps looking for more things that are great in our life. I've got a gratitude practice where myself and 4 other people text 3 gratitudes to each other every day. It's been going for 3.5 years. It is so powerful. What's great about it is you get accountability because they're expecting you to get your gratitudes. The second thing is that you get a reminder when theirs pop in. And what I didn't anticipate, which I think is actually the best thing of all about it, is you actually get to vicariously live their joy. So not only are you in touch with what's amazing in your own life, but you actually get to experience their joy as well. So it's like a mega dose of gratitude. You can practice gratitude in lots and lots of different ways. Brené Brown actually found in her research that 100% of the people who identified as joyful said that they had a gratitude practice. So she said not an attitude of gratitude, but an actual gratitude practice. So I really encourage you to explore using gratitude in your own life. Now, does anyone have any questions? Do we have time for questions, Angela?
We do. I'm just having a look. You're very welcome if you'd prefer, if you've got a specific question for Donna and you'd like to type it into the chat box, then I can read that out on your behalf, or you are able to unmute yourself if you would like to ask a specific question. So I'm just watching the chat box with eagle eyes. It looks like we're okay at the moment. Oh, okay, so no, you're fine. So is there anything you'd like to leave us on, Donna? And I'll do a couple of close-offs as well.
Okay, I feel like I rushed through that quite quickly. There was a lot of information. I really encourage you to develop some mental health literacy and skills. We can really make a difference in our own and other people's lives. And the fact is that mental illness is treatable. Don't see a professional about their mental health problem, and we need to change that. We need to destigmatize this, and we need to be able to look out for and support each other and normalize mental health so that more people can be well and be at that green end of the zone or the continuum.
Absolutely. So thank you so much, Donna, for spending your time with us. I'm going to pop up a poll in a moment to get just a one-click piece of feedback as to how people found this valuable today. But what I'd like to stress is, number one, a recording is coming out. So if you'd like to revisit some of these topics or share it with somebody that is close to you, whether that be a staff member, a colleague, a friend, a family member, because the messages that were in here are extremely practical, which brings me to the second point. We can all listen and hear new things, but what's most important is to make a choice, make a decision now as to at least one action that you will take as a result of what you've learned today. Actually taking care of your own mental health, keeping that buoyant, is the same sort of concept as putting on your own oxygen mask on the plane before you turn around to help someone else as well. So incredibly important that we make a commitment to take that sort of action. So I'm just going to pop up the poll. And what we're just looking for here is on a scale of 1 to 5, where 1 is, yeah, not really, and 5 is awesome. If you could give us a quick indication of how you've found the usefulness and practicality of today's masterclass, that would be wonderful. So we're seeing I'm seeing a lot of voting coming in here. Lots of 5s, lots of 4s, and 1 or 2 3s. So there's lots and lots of great feedback here.
Awesome.
Donna, I think there was something that you were about to say to me.
I was just going to say, if people want to indicate in the chat box what they'd found helpful from today too, that would be great feedback.
Awesome. So there's that opportunity as well. If you'd like to pop something into the chat box, when we get feedback, it just makes it obviously easy for us to then improve the next masterclass that we run, if there's a particular topic that you're after as well. Katie has said, thank you, Donna. That was amazing. Peter said, pitched at a great level. Thank you so much. That is wonderful. Okay, the last thing, guys, is that when we send out the recording, there will also be the handout that Donna has referred to, which will be very useful for you to go back and have a look at, to revisit some of these very important points that we've shared. Another person, Donna, Katie, has asked how to deal with denial when approaching someone. That's a big piece. So there may be something extra that I can share out when we do the newsletter follow-up, but is there anything that you'd like to... Oh, no, that's my feedback. Okay, my apologies. I'm just checking that box.
Yeah, okay, I'm with you. Because I was like, I did cover that. Do I need to go back into it? Yeah, okay.
That was one of the most useful things. Okay, fantastic.
Awesome.
And I'll also put the link to some of those. The handout has the link to some of the places that Donna referred to that are really helpful first ports of call when you're looking to get some assistance to assist somebody else with their mental health challenges. So this is the... Sorry, yep.
I was just going to say, you're very welcome to visit my website. I know it's on the handout. I offer mental health first aid training and also resilience training. And I'm pretty sure, if there's not already, I think a gratitude guide is on there. It talks about a number of different ways that you can do gratitude.
Awesome. I'll make sure that that link is in the email that comes out as well.
Great, thanks.
So this was the second of the two masterclasses that we've run lately. We're having a wee rest and we'll bring in some more. Now that you have been a part of these classes, we'll make sure that you receive an email invite to any future masterclasses we're running. Some are going to be more business oriented, some are going to be more personally oriented, because the two of them are so closely woven together. And DFKANZ as a whole is really committed to taking care of and supporting business owners right through that cycle, because we know that our business and our personal growth are completely interwoven. So again, thank you for spending your time here with us today. Thank you, Donna, and we will see you on the next calls. Until then, take very good care.
Bye.
Bye.